You know, 1%,
taxation?
1% of the New Zealand public own the country. I mean, the billions of dollars. It's really interesting. Money is one of the few things in the world which defies the laws of gravity. It floats up. Under the neoliberal system, all the money that you're talking about has been floating up to the top. And the bottom 25% haven't really got enough money to live on.
So do you think there is an appetite in the New Zealand public for what would be quite a radical shift when it comes to tax and redistribution in order to fulfil what you see as a better healthcare system?
I think if they felt their taxes went into health and nowhere else, I think there will be more. There was a survey done not that long ago saying, would you be prepared to pay more taxes in order to have better health system and education system? The vast majority said yes, so long as they know where it's going. At the moment, we pay our taxes, we have no idea where it goes.
What kind of support have you had within the medical fraternity for your alternative vision?
Well, it varies a great deal. One of the problems is some of the major organisations in health are not speaking out adequately enough.
Right.
The colleges should be speaking out about this issue, and the unions should. The unions have done some, but they should be getting together and they should be saying that what is planned here long term is not in the long-term interests of the New Zealand public, and explaining what is a difficult situation. It's hard to understand, but if people understood just how bad it's going, they would appreciate the need for radical change.
I think doctors and nurses are fed up with not being allowed to do what they're trained to do. And that's what's happening in our hospitals right now. That's why 36,000 nurses are going on strike. They're fed up with going into work, being stressed the whole time because there's not enough nurses to look after the patients, not being allowed to do their job that they're trained for. That is a disastrous combination.